Breaking news tonight, the coronavirus forcing millions more Americans into virtual lockdown. Over 75 million people in New York, California, Illinois, and Connecticut ordered to stay at home. The U.S. borders to Mexico and Canada set to close to non-essential travel. A spring break crackdown. Florida communities closing beaches. In Europe, the crisis growing inside the ICU in Italy, the country's deadliest day. Fear on the front lines. ER doctors saying we are on the verge of a medical disaster. Healthcare workers' lives at risk.
There's a lot of anxiety. There's a lot of fear. There's a lot of, wondering if you're risking your life by going to work. Critical shortages of life-saving equipment. President Trump invoking war powers to order private companies to manufacture supplies. New developments on that $1 trillion relief plan. How soon Congress could approve those checks for you. The staggering rise in unemployment. People out of work lining up for free meals. The healthcare crush. Vital treatments delayed. Our correspondent battling cancer, feeling the impact firsthand. The surge in students learning from home. Over 50 million taking lessons online. But what about the kids without internet access? And does the coronavirus present a bigger risk to pregnant women?
This is NBC Nightly News with Lester Holt.
Good evening. It was just a little over 10 days ago we were all shaking our heads at news that Italy was locking down the entire country to stop the spread of COVID-19. Awful, we thought. But it couldn't happen here, except it slowly is. State by state, residents now being ordered to stay indoors. Non-essential businesses told to close. The latest, Connecticut, as the wave of sickness appears to be following the grim predictions. Again tonight, our team is going to explore the facts, the ramifications, and what our leaders are doing to protect us. We start with Miguel Almaguer.
Tonight, the governors of New York, California, Illinois, and Connecticut taking drastic and historic action. Residents of multiple states told to go home and stay home as the coronavirus crisis explodes across the nation, affecting at least 76 million people. The orders, which if violated could include a civil fine, means all non-essential businesses must close, while places like grocery stores, gas stations, and mass transit continue to operate. Going out to pick up food or supplies or solitary exercise like a walk or hike are permitted.
And when I talk about the most drastic action we can take, this is the most drastic action we can take.
As the number of confirmed cases skyrockets in New York, in California, the most populated state in the nation, they have doubled. In a letter to Congress, Gavin Newsom is requesting $1 billion to fight the virus and asking for the USNS Mercy, a floating hospital, to dock in Los Angeles.
This is a moment where we need some straight talk, and we need to tell people the truth. We need to bend the curve in the state of California.
With California bracing for 20% of those infected with the coronavirus to be hospitalized, in Washington state, where the death toll is the highest, officials say they are preparing to ration health care, including ventilators.
The notion that this could happen in America, where we can see something coming and we can't get the resources here to avert it, is ridiculous. It should not happen.
In uncharted territory, today the U.S. government extended the federal tax deadline 90 days, the first time in history, hoping to ease the financial burden on all Americans. With both the Mexican and Canadian borders closing to non-essential travel, the CDC is worried Border Patrol agents face a serious risk of becoming infected. The crackdown on large groups spreading coast to coast. Orange County, Florida, which includes Orlando, will have a curfew beginning tonight. Kerry Sanders is across the state.
The conflicted images of states like California that are shut down, while here in Clearwater, Florida, spring break continues, has finally hit a breaking point. This beach will close down tonight, and already some college kids seem to be getting the message, packing up, heading home.
Just 4 months away from the Tokyo Olympics, USA Swimming is now officially calling for a one-year postponement of the Games. Facing a new reality, tonight we are all reminded of what's at stake. This, the changing face of a nation, perhaps more connected than we are apart.
The U.S. Olympic Committee says it's premature to make a decision about the Summer Games. As for that go-home order here in California, it's open-ended, but the mayor of Los Angeles says it could last upwards of 2 months. Lester?
All right, Miguel, thank you. And at the nation's hospitals tonight, a worsening situation as doctors and nurses try to save lives, increasingly without the protective gear and equipment they need. Tom Costello has the latest.
The warning from the nation's frontline ER doctors, the situation is critical.
What we're dealing with right now is something most of us in our careers have never seen, which is a slow roll mass casualty incident.
With doctors and nurses running low and now reusing personal protective equipment, communities are stepping up and making masks. New York City is warning it will run out within 2 weeks. UMass Medical near Boston says it's a matter of days.
Right now, our number one priority is getting those N95 masks, and the gowns would be number two. Gloves and eye shields will be right behind it as well.
Also in high demand, ventilators for the most critically ill patients.
We need those ventilators. The ventilators are to this war what missiles were to World War II.
Nationwide, hospitals have roughly 160,000 ventilators, but doctors warn they may need as many as 960,000 in a worst-case scenario. Columbia medicine surgeon Cornelia Greggs wrote a New York Times op-ed warning the sky is falling.
It feels like living in a terrifying sci-fi movie, but this is real life. And in the United States, our hospitals, at least in New York, are going to start to look like Italy's hospitals.
The president today announced an automaker is offering to produce ventilators.
One company that has openly stated it is General Motors.
Ford tells NBC News it's also offered to help. And 3M says it's now making 400 million N95 respirators a year. Meanwhile, continued frustration over testing for the virus.
They said, oh, you got to go to the hospital. But then again, they tell you to stay away from the hospital.
Based on data collected from state health departments, NBC News calculates more than 117,000 COVID-19 tests have now been completed, as most states struggle to meet demand. A newly opened site in Paramus, New Jersey today filled to capacity and forced to close within 4 hours. While on the front lines, doctors are already battling to save lives.
There's a lot of anxiety. There's a lot of fear. There's a lot of, wondering if you're risking your life by going to work. But we're feeling, abandoned. We're feeling isolated.
With supplies and medicine running low, hospitals are now preparing to make terrible decisions about which patient has a better chance of survival and which patient may be denied the care they need. Lester?
Yeah, Tom, this is so troubling. These are the people we absolutely need. Thank you. The devastating and deepening impact on business pushed the markets down again today. The Dow tumbling more than 900 points to end Wall Street's worst week since 2008. Gabe Gutierrez now in the sudden and staggering rise in unemployment.
It's become a daily ritual. Newly unemployed hospitality workers are coming to Hook Hall in Washington, D.C. Coronavirus forced this bar to close. Now, with donated supplies, volunteer chefs are feeding those who are out of work from around the area.
It's jarring. It's so jarring to see the number of people come through the door.
Yesterday, the Labor Department said last week's nationwide unemployment claims were up dramatically. Tonight, an even bleaker picture from individual states. In South Carolina, unemployment claims this week have shot up at least 400%. Colorado, 875%. Oregon, more than 2,100% in just 2 days.
This is just the tip of the iceberg because it's only a couple of days and it's only 21 states. It could be as many as 2 million people.
Across the country.
I mean, it's a mess.
Workers like Lorenzo Landini of New York are complaining of jammed phone lines and crashing unemployment websites.
It's stressful. It's really stressful. And, first time unemployed in my entire life since I was 16.
Bartender Beverly Barber got her last paycheck today.
You don't know where your next dollar is coming in from.
The owners of this bar say they've been forced to furlough dozens of their hourly workers. With no customers, they're doing what they can to serve each other. Lester?
All right, Gabe, thank you. Also breaking, that $1 trillion relief package that includes direct payments to Americans appears to be coming together, plus President Trump on whether we need a nationwide lockdown. Peter Alexander at the White House now.
With strict new measures now being implemented in the hardest hit states like California and New York to slow the spread of the virus. Tonight, President Trump says a national lockdown is not needed.
We're working with the governors, and I don't think we'll ever find that necessary.
Lawmakers tonight are still hashing out an expected $1 trillion economic relief package with those direct payments up to $1,200 possibly for many Americans, $500 per child.
There's tremendous spirit to get something done, so we'll see what happens.
It comes a day after the president touted the immediate delivery of existing drugs that have also shown promise treating coronavirus, but are still in clinical trials and have not been approved for that use.
Is it possible that your impulse to put a positive spin on things may be giving Americans a false sense of hope?
No, I don't think so.
Representing the preparedness right now?
No, I don't think so. I think that I think it's got
the not yet approved drug.
Such a lovely question. Look, it may work and it may not work. I feel good about it. That's all it is, just a feeling. I'm a smart guy. I feel good about it.
What do you say to Americans who are watching you right now who are scared?
I say that you're a terrible reporter. That's what I say. Go ahead. I think it's a very nasty question, and I think it's a very bad signal that you're putting out to the American people. The American people are looking for answers, and they're looking for hope. And you're doing sensationalism.
We asked the vice president the same question later.
What do you say to Americans right now who are watching and who are scared?
I would say do not be afraid, be vigilant. All the experts tell us that the risk of serious illness to the average American for the coronavirus is low.
And late tonight, the White House announced that a member of the vice president's staff has tested positive for coronavirus. The White House tonight says neither President Trump nor Vice President Pence had close contact with that individual. Lester?
All right, Peter, thank you. This crisis, this horror we're going through is perhaps too easily reduced into numbers. The number of tests, the numbers of infected, the number of dead. Allow me a moment to put just one face to those numbers, a face we here at NBC News know well, our colleague and friend Larry Edgeworth. We lost him to this virus last night, and we, like families everywhere who have suffered loss, are grieving. Larry was an audio engineer. He worked in the field covering stories all over the world. Larry and I logged some interesting times together in some interesting places. If Larry was your sound guy, you knew you were going to be fine, both technically and in every other way. A gentle giant, as one of our colleagues so aptly described him, who you knew had your back. Larry was a kind and generous man who always made us smile. Our heartfelt condolences to Larry's family and his many colleagues here at NBC. We are heartbroken. And there's so much more to tell you about tonight, including a staggering development of the epicenter of this crisis. We'll be back in just 60 seconds.
Dad, I'm scared.
It's only human to care for those we love and also help light their way. It's why last year Chevron invested over $10 billion to bring affordable, reliable, ever cleaner energy to America.
At Fisher Investments, we do things differently, and other money managers don't understand why.
Because our way works great for us.
But not for your clients. That's why we're a fiduciary, obligated to put clients first.
So what do you provide? Cookie-cutter portfolios?
Nope. We tailor portfolios to our clients' needs.
But you do sell investments that earn you high commissions, right?
We don't have those.
So what's in it for you?
Our fees are structured so we do better when our clients do better. At Fisher Investments, we're clearly different.
The coronavirus crisis has deepened in Europe, with Italy suffering its deadliest day yet, with more than 600 fatalities. NBC's Richard Engel has more.
From above, Rome looks as empty and lifeless as people say it feels. But despite Europe's tightest lockdown, authorities say the death toll is still spiking. At least 627 new fatalities in just 24 hours, a one-day record. In the hardest hit north, emergency rooms are at, or some doctors say past, the breaking point. Sky News gained rare access to an intensive care unit in the city of Bergamo. 50 to 60 new COVID-19 cases here each day. Doctors urging the world to act now.
What I would suggest is just shut down to stop all the outbreak and not coming in this kind of situation.
I spoke to an Italian reporter about the Sophie's Choice Italian doctors now face.
We hear about doctors who are having to make life and death decisions, deciding who's going to live, who's going to get the ventilator, who's going to get the hospital bed, who's going to get treatment, and who's not.
It's true. They are choosing based on life expectancy and other factors who can live and who cannot be treated properly, which is something absolutely completely foreign to our culture.
COVID-19 is blanketing and changing how we all live. Richard Engel, NBC News, London.
Another side effect of the pandemic, patients with chronic, even life-threatening diseases are being told their treatments will have to wait. Our colleague Kristen Dahlgren, who is battling breast cancer, has seen the impact firsthand.
Good evening, Lester. Well, I was just days away from starting my radiation therapy when I got a call this week that it was being delayed. Luckily for me, it's just a short delay for now, but that's not the case for so many others.
Tonight, Anna Rashova is treasuring every moment with her 2-year-old daughter.
Speckled chuckled and shook his head. No.
After learning her last hope to beat stage 4 colon cancer, a clinical trial for an immunotherapy drug is being postponed.
To be so close, and it's almost like right there in front of my face, yet I can't touch it. It's definitely heartbreaking.
Hospitals across the country now deciding many clinical trials could expose vulnerable cancer patients and health workers to COVID-19. But Anna's doctor worries she doesn't have time to spare.
They're talking about that it now might be July or August. So July or August is infinity for people like me.
Nearly 2 million Americans are diagnosed with cancer every year.
The unfortunate and very sad reality is that for many of those patients, they do need that treatment now.
Hospitals are asking many to do appointments online, skip follow-up visits, and in some cases, even delay treatments. Also being postponed, routine screenings like mammograms and colonoscopies, raising new concern that cancer diagnoses will be missed.
They're closing clinics, not only for cancer patients, but for other patients as well.
Even urgent surgeries like organ transplants are being performed on a case-by-case basis. For 35-year-old Anna, it's especially hard seeing other young people ignoring the guidance on social distancing.
I am someone's sister, I'm someone's mother, and for those people to be so irresponsible, for them to want to grab a drink is more important than the reality that we live in.
A reality that may mean COVID-19's victims aren't just those who contract the virus, but those who now can't get treatments they need.
I love you.
Kristen Dahlgren, NBC News, New York.
My goodness, the ripple effects of all of this. Tonight, President Trump announced the federal government is canceling requirements for standardized tests. With schools closed in 44 states, parents now facing a new challenge at home. Here's Morgan Chesky with that.
Tonight, schools across the country empty. The rush to contain COVID-19 giving millions of parents a brand new job.
A coronavirus quarantine, so we are just held up in the house.
It'll be a few challenging weeks, I'm sure.
Nationwide, 45 states have shut down schools entirely. More than 52 million students now forced to learn from home.
All right, girls, go ahead and get out your math workbooks
For teacher Sarah Jane Rust, that means kitchen table math classes before taking her 2 girls outside for a little science.
What are you telling your friends with kids now?
That it's going to be okay. I would say set a schedule for your family that works, talk to your child's teacher, and own it. I mean, just take ownership of it.
For those with access to a screen and reliable internet, another option, online learning.
All right, we are doing a sight reading example in the key of D major today.
In New Jersey, Ariel Siegel, one of many teachers now fully reliant on tech, making sure students hit all the right notes.
Are you ready to go virtual indefinitely?
We're able to communicate, but to actually perform and sing in time, that's a reason why I would hesitate to say I'm ready for complete virtual learning.
Now, virtual learning does face some hurdles. Up to 12 million kids don't even have access to reliable internet. That's why lawmakers are calling for the purchase of special Wi-Fi hotspots to give to schools that need it most. Lester?
All right, Morgan, thank you. Coming up tonight, COVID-19 and pregnancy. What do you need to know?
I've always been fascinated by what's next and still going for my best, even though I live with a higher risk of stroke due to AFib, not caused by a heart valve problem. So if there's a better treatment than warfarin, I want that too. Eliquis. Eliquis is proven to reduce stroke risk better than warfarin, plus has significantly less major bleeding than warfarin. Eliquis is FDA approved and has both. What's next? Reeling in a nice one.
Don't stop taking Eliquis unless your doctor tells you to, as stopping increases your risk of having a stroke. Eliquis can cause serious and, in rare cases, fatal bleeding. Don't take Eliquis if you have an artificial heart valve or abnormal bleeding. While taking Eliquis, you may bruise more easily, and it may take longer than usual for any bleeding to stop. Seek immediate medical care for sudden signs of bleeding, like unusual bruising. Eliquis may increase your bleeding risk if you take certain medicines. Tell your doctor about all planned medical or dental procedures.
Eliquis, the #1 cardiologist-prescribed blood thinner. Ask your doctor if Eliquis is what's next for you.
What's important to you?
Saving for Ava's college.
Financial security.
Being able to retire.
On our
terms.
No matter what your goals are, our trusted advisors can help you reach them. Ameriprise Financial.
Restaurants have always been there for you. A place to celebrate, to take a first date, to grab a meal between soccer practice and piano. And even though tables are empty at the moment, the kitchens are full, prepping everything so it's just right, keeping customers safe, and making the food as delicious as ever. They're still there for you. Now you can be there for them. While the doors may be closed, the kitchens are open for delivery.
Feel the clarity of non-drowsy Claritin and 24-hour relief from symptoms caused by over 200 indoor and outdoor allergens, like those from Buddy. For 1 week only, save up to $26 in select Claritin products. Check this Sunday's newspaper for details.
Beautiful. But support the leg. When I started Cobra Kai, the lack of control over my business made me a little intense. But now I practice a different philosophy. QuickBooks helps me get paid, manage cash flow, and run payroll. And now I'm back on top with Koala Kai. Hey! More mercy.
Save over 40 hours a month with Intuit QuickBooks, the easy way to a happier business.
At Walgreens, we love smart savers. Like movie savers. Tea time savers. And especially Medicare Part D savers. So you probably know making Walgreens your preferred pharmacy means up to $5 off on copays and 100 rewards points on prescriptions. Because you're smart like that. Save smartly on Med D. Walgreens, trusted since 1901.
All right, welcome back. Joining me now is our medical correspondent, Dr. John Torres. John, I want to get to a question we're hearing from a lot of pregnant women. They're certainly worried about the virus. What should they know?
Lester, there's some evidence a pregnant woman with coronavirus may deliver a little early, but so far there's no evidence that will affect the baby long term. Now, research hasn't yet shown that pregnant women are at a higher risk for coronavirus, but pregnancy does suppress a woman's immune system, making her more vulnerable to respiratory infections in general. So, of course, to prevent an infection, in addition to hand washing and social distancing, pregnant women might want to avoid having any visitors because even if someone doesn't look sick, they could still be carrying the virus.
All right, Dr. John, thank you. And up next for us tonight, reflections on a week that has tested America.
If you have moderate to severe psoriasis or psoriatic arthritis, little things can be a big deal. That's why there's Otezla. Otezla is not an injection or a cream. It's a pill that treats differently. For psoriasis, 75% clearer skin is achievable with reduced redness, thickness, and scaliness of plaques. For psoriatic arthritis, Otezla is proven to reduce joint swelling, tenderness, and pain. And the Otezla prescribing information has no requirement for routine lab monitoring. Don't use if you're allergic to Otezla. It may cause severe diarrhea, nausea, or vomiting. Otezla is associated with an increased risk of depression. Tell your doctor if you have a history of depression or suicidal thoughts, or if these feelings develop. Some people taking Otezla reported weight loss. Your doctor should monitor your weight and may stop treatment. Upper respiratory tract infection and headache may occur. Tell your doctor about your medicines and if you're pregnant or planning to be. Ready to treat differently with a pill? Otezla. Show more of you.
Introducing the Capital One Walmart Rewards Card. Earn unlimited 5% back on everything you buy at Walmart online.
No. We're gonna need a mop and bleach.
Including things for your new puppy.
What's in your wallet?
Hey, fellas. We've got to talk. It's about your food. It has spray-on flavor and powdered meat. It's time for fresh food that belongs in the fridge next to our food. Now, who's hungry? Freshpet.
Thousands of women with metastatic breast cancer, which is breast cancer that has spread to other parts of the body, are living in the moment and taking Ibrance. Ibrance with an aromatase inhibitor is for postmenopausal women or for men with HR-positive, HER2-negative metastatic breast cancer as the first hormonal-based therapy. Ibrance plus letrozole significantly delayed disease progression versus letrozole and shrank tumors in over half of patients. Patients taking Ibrance can develop low white blood cell counts, which may cause serious infections that can lead to death. Ibrance may cause severe inflammation of the lungs that can lead to death. Tell your doctor right away if you have new or worsening symptoms, including trouble breathing, shortness of breath, cough, or chest pain. Before taking Ibrance, tell your doctor if you have fever, chills, or other signs of infection, liver or kidney problems, are pregnant, breastfeeding, or plan to become pregnant. Common side effects include low red blood cell and low platelet counts, infections, tiredness, nausea, sore mouth, abnormalities in liver blood tests, diarrhea, hair thinning or loss, vomiting, rash, and loss of appetite. Be in your moment. Ask your doctor about Ibrance.
What's important to you?
Saving for Ava's college.
Financial security.
Being able to retire.
On
our terms.
No matter what your goals are, our trusted advisors can help you reach them. Ameriprise Financial.
Every morning, we are with you today for the latest developments, expert advice on your questions, and how we're all connecting while apart.
I'm working from home. We're still together.
Everybody who is separated from their loved ones, we are with you.
Every morning on Today.
NBC Nightly News with Lester Holt, covering coronavirus with facts over fear.
How do we know who belongs in isolation? What should we be conscious of? What's being worked on today?
At a time of crisis, turn to the most trusted TV news anchor in America.
At the end of a tough week, Harry Smith is seeing America in a new way.
America is going through a kind of vision test, an exam on how we view one another. Do we see only ourselves, or do we get the bigger picture? Those Gen Z types partying on the beach could use some corrective lenses. And for the TP hoarders, you know who you are. Seriously? On the other hand, hip hip hooray for the folks in the grocery stores and pharmacies and the people who resupply them. And for those on the front lines, nurses, paramedics, PAs, and doctors, gratitude is not a good enough word to express our appreciation. And also thanks to their families, who know with every patient comes some risk. Finally, to the social distance superstars, who realize keeping your distance is the best way to slow the virus. Indeed, our best expression of loving your neighbor. Maybe we should call it 2020 Vision. Harry Smith, NBC News.
We have got to focus on the good around us. That's Nightly News. I'm Lester Holt. Take care of yourself and each other. Hey, NBC News viewers, thanks for checking out our YouTube channel. Subscribe by clicking on that button down here and click on any of the videos over here to watch the latest interviews, show highlights, and digital exclusives. Thanks for watching.